This ASCO podcast provides observations and commentary on the Journal of Oncology Practice article, Importance of Testing for Usability when Selecting and Implementing an Electronic Health or Medical Record System in the May 2010 issue. This is Dr. Robert Miller, and my discussion today is entitled Electronic Health Records and Usability. I'm a clinical associate in the breast cancer program and physician advisor medical informatics at the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins in Baltimore, Maryland, and I specialize in medical oncology. Our guest tonight is Dr. Arash Naeim. Dr. Naeim is the Director of Informatics at the Johnson Comprehensive Cancer Center at UCLA and a medical oncologist. And welcome, Dr. Naeim.
Thank you.
Please tell us a little bit about your background and your research interests in coming up with this investigation.
Sure. So, my background is in both geriatrics and hematology oncology, and the patient population that I'm interested in has very little data in terms of clinical trials, and as a result, I have an interest in health outcomes and public policy, and was very much interested earlier in my career in terms of figuring out the best ways of collecting clinical data and patient-reported data from this population. And in our institution, one of the best ways I thought we could do that was to implement an EMR or EHR as a source of clinical information in this particular patient population, but of course it affects all our oncology patients overall.
So tell me a little bit about what the background is on the health IT landscape at UCLA. I gather you've been using an electronic health record for a number of years. And can you tell us a little bit about your system and maybe how the implementation went when you put that in?
Sure. So prior to 2002, we were primarily using paper across the institution in oncology. And then in 2002, there was an active interest in trying to find an electronic approach to chemotherapy ordering. Around that time, there was a startup company that UCLA started to work with for that purpose, and that quickly evolved into something bigger than just drug ordering, but also in terms of documentation of both physician, nursing notes. And so we piloted out a version of that software in late 2002, early 2003, and the pilot seemed to go well. And then since 2003, we've been using a oncology-specific electronic medical record system.
Is that a vendor solution, or is that something?
It is. It's a vendor solution, but the vendor was a startup company that subsequently decided not to really focus on this particular industry, and as a result, over the course of the last few years, we've been looking at switching to an alternative vendor and are in the process of kind of migrating from the current vendor we have to a new vendor. We actually never anticipated that any particular solution would necessarily serve our benefits for more than 7 or 10 years, and we're in year 7 actually right now. And when we started this, the number of options in the oncology EHR world were more limited. Over the course of the last, I would say, 7 or 8 years, there's been a huge expansion in the number of vendors in the marketplace. And in addition to that, we really didn't have the benefit of being able to objectively compare EHR vendors when we initially went down this path. But as a result of a lot of efforts, especially ASCO's efforts in terms of building an availability of a way to look at these EHR vendors using standard use cases at their annual meeting and at other venues, we were able to kind of compare our application to the other ones that are existing kind of in the marketplace. And because of the fast movement of kind of development in this area, we felt that there might be better options for us available.
Mm-hmm. Yeah, it's amazing how much things have exploded in the last couple of years in this space. So, well, let's talk a little bit about the work that was published in JOP. We're talking mostly about the topic of usability, which I'm personally very interested in. And in the issue, Robert Schumacher wrote an opinion piece to accompany your research. And in his opinion piece, he uses the definition of the word usability as applying to both a property and a process. And I'm just wondering if you agree with that definition, and maybe you could tell us what you think usability means as it applies to an electronic health record.
Sure. No, I mean, I think I would definitely agree with them. I think that the whole idea of usability has several components that I think is worthwhile considering. One is, there should be some objective measures of usability, and in that sense, it's a property that could be applied by some experts in the field and maybe even scored as kind of an objective measure of usability. I think any particular sort of electronic health record or medical record, it's sort of usability also has to kind of fit into a specific workflow or practice. It's kind of the applied usability in the environment in which it's actually going to be used. And then, I think a really good point that Shoemaker raises is that standard principles of usability have to be applied at the process of design from the start. Mm-hmm. And so there's the process of usability in terms of design that I think he makes a very valid point of. I think, for most of us who are medical oncologists who are feeling this big push, if for those that haven't adopted an EHR yet, is to kind of pick and then to implement one. And so I think from that perspective, usability, I think, is one component that may not have gotten as much notice kind of from the basic user's perspective. And from my viewpoint, it's kind of simplistic. I think it's a lot like buying a car. You can read consumer reports about cars that someone might be interested in that compare their speed or braking or how much leg space they have. But most of us would never buy a car unless we give it a test drive. And we each have our specific sort of preferences in terms of what we like or don't like about a car, and particularly because of the way we might drive a vehicle, whether we have our own styles. But independent of that, we all hope that car manufacturers take into account some basic principles of usability whenever they design a vehicle. And sometimes they do a good job, and sometimes they do a poor job. So, I think all of those elements are really kind of important concepts in terms of usability overall.
So let's talk a little bit about the specific research question that you were trying to address in your paper. So tell us a little bit about the process that your group undertook to get to this investigation.
Yeah, so essentially we wanted to see if novice users, people who were unexposed to the application, could identify issues of usability if we gave them some sort of framework to evaluate an application. And the background to this is that, we had gotten to the point where we were about to negotiate with our vendor about significant improvements in the application. So we wanted to kind of figure out what the best approach was to inform that. So we developed a simplified form that gave some examples of usability issues and then had them work through a case scenario. And as they were doing that, we wanted them to think aloud so we could kind of hear their thinking process as they were going through the process of using the application, as well as having one of our trained staff members who understood informatics to take notes as they were kind of visualizing their use of the system. And then based on those sessions, we took the information that was gathered and we tried to categorize and synthesize them into kind of the general heuristic or usability violations that one might commonly see with these sort of things. In the paper, we talk about these categories of match or visibility or memory or error or consistency or how flexible or how much control people might have, and trying to figure out where these sort of issues fell. And once we did that, we reviewed them, and we tried to come up with recommendations for improvement based on those, and reviewed those with an expert panel of experienced users, people who were using the system for at least a year, and found that there was a high degree of agreement, that the people that were experienced users agreed with the sort of issues that the people that were novice users identified by going through this exercise, which to us seemed to indicate that you could probably identify a lot of these issues from the get-go. You didn't necessarily have to use an application for a year to identify issues that might be problematic. And the other thing that we wanted to do is we surveyed kind of the users that were using the system and found out that there was a certain level of dissatisfaction, and whether that was in efficiency or their ability to kind of manage or track data, that it could be, we weren't entirely sure because we didn't measure this as part of the research, whether or not the satisfaction level with efficiency or other components was related to usability, but we think that there might be. And nevertheless, regardless of this, our users probably wouldn't have wanted to go back to paper, and the majority didn't, even with some of the satisfaction issues there were with the system that we had in place. But it also indicates that there's a significant room for improvement, and addressing these issues might be useful.
I think in your paper there are two very interesting tables. One is where you list the categories of heuristic violations and then some examples. And I think as a fellow user of electronic health records, there was a lot of recognition. I think a lot of our readers probably looked at this and said, yeah, that makes sense. I mean, as an example, things that just not matching, the name of the tab is not reflective of its content, or the things that are visible or invisible. One of the comments was relationship between checkboxes and text boxes is not readily apparent. So I think it seems pretty obvious that these things would make a product more difficult to use, but I guess it is hard when you're designing a product, and certainly when you're assessing one to really pick these things out. The analogy you use about buying a car, I think is good. I just wish an EHR cost as much as a car. So.
Well, and I guess it depends on how expensive of a car you're buying, but I mean, I don't think any one of us would allow, for example, the sales representative to drive the car for us, and then decide that we're going to buy the car. That would never be sufficient for us. But for a lot of these EHRs, a lot of people used to, and probably less so now, buy by virtue of a demo or
sure.
two, where someone that kind of knows how to circumvent some of the maybe usability issues can demonstrate that something is easy to use, but may not be as easy to use for someone that may be unfamiliar with it, or a medical professional that has a different way of looking at things.
Sure. Let me ask you about the generalizability of this research. Do you think that the lessons that you came up with from this, do you think this can be applied to other institutions and maybe other settings, say like a small medical practice?
Well, I mean, I think that it probably can, because my sense is, just from looking at people that kind of wander through some of kind of the vendor halls, is that they look at these oncology-specific EHRs, and what they're really interested in is what features does it have, and what content does it have, and they don't necessarily understand how that translates to functionality and efficiency in their own practice. And I think we demonstrated that just there are very in-depth sort of heuristic and usability testing, but even with some very basic usability testing, either whether it's done prior to purchase or whether it's prior to implementation, or even before one provides the final acceptance and payment out to their specific EHR, that at any of those steps, doing some basic usability testing could potentially be invaluable. One can either select an EHR that's more appropriate for their particular practice, or they can even adopt or push the vendor to make some changes so that the transition to any EHR is oftentimes pretty traumatic. It was for us at our institution. Going from paper to an EHR is a big thing. And to try to get people to adopt in your practice, you also want them to have a high level of satisfaction. And oftentimes that satisfaction really comes to how usable the thing is on a day-to-day or patient-to-patient specific actions that the person has to do. And I think a little bit of investment and focus in this area may have payoffs that are much more significant than some of the other things we focus on generally.
So I think in the accompanying editorial, Robert Schumacher, he lists some very valid reasons why EHRs sort of historically have a reputation of being difficult to use. How do you think oncology is different? Or maybe I should ask you, do you think as a specialty, when we're talking about oncology-specific EHRs, do you think the usability is more important?
Well, I mean, I think what ends up happening is, Schumacher identifies some really valid reasons. people maybe who are looking at these, they may fail to kind of take human factor design principles into account, or that a lot of these applications are only one within many kind of in our environments, and we may have to go from jump between a variety of applications, and there's not as much consistency either within or across applications. But oncology, I think, is really at risk really for usability issues more so than other applications. One, we expect a lot in oncology in terms of functionality, so we put such a huge emphasis on it. We want it to do a lot of things. The chemotherapy ordering is such a big component of it, but so are all the other things that we have an interest in. And so, there's a huge functional demand of these sort of applications. And then our workflow is very, very complicated. It's complicated in terms of providing a high-quality care to the patient, but it's also complicated because we have to do that in an environment where reimbursements and other things are tight, and so the business sort of operational aspect of how an application works is a high priority. So, what ends up happening, I think, a lot of times is that the development of a lot of these oncology-specific applications starts with a nucleus of individuals who really understand the kind of provision of care and the business side of oncology. And those experts may not be the same experts that might be the best, in terms of EHR design principles. And so what ends up happening is that the overall product, may do well in certain areas, but may have weaknesses in others. And, there may not be as many of the folks that really understand how to design an EHR being incorporated for these really specialty-specific EHRs.
Well, Dr. Naeim, we thank you for your time and for your research. This concludes this ASCO podcast. Thank you very much for listening.
I really appreciate it.